My name is Leslie Thompson, and my research prospectus is on the use of probiotics in Crohn's disease. So, what is Crohn's disease? Well, Crohn's disease is part of an inflammatory bowel disease, IBD group, and it affects the entire gastrointestinal tract, from the mouth to the anus, and from the mucosa to serosa, so all the layers of the gastrointestinal tract. It is also immunologically mediated, which means there's an immune response. Something is going haywire here. And so we have all the layers here of the gastrointestinal tract. And so we have inflammation that causes cobblestoning, and that's due to scar tissue. Or we can also have fistulas, which are basically abnormal openings that goes all the way down to the serosa. And these abnormal openings, or we can think of holes, create fluid going to areas where they should not go. So we can see here with the epithelial damage, there's no longer a tight junction anymore, and this can be life-threatening if we have fluid going somewhere it should not be going. This response is caused by inflammation by the T cells going against bacteria, and something doesn't go right. They create cytokines, and the cytokines create interleukins, and something does not turn off. So we're not really sure what is the etiology behind Crohn's disease. It maybe is environmental, toxins, antibiotics, infections, microbes. We're not really sure. One of the interesting things we're seeing is cases are going up in some countries, some Asian countries, for example, as they're adopting more of a Western diet. Does it have something to do with what we're eating? We know genes are not all of it, but we do know genes are part of the reason for Crohn's disease. For example, in people who have FUT2, they're more likely to have severe Crohn's disease, and they're more likely to get it younger as a child. The current research on probiotics and Crohn's disease continues to be inconclusive, with a B rating at best, due to small sample sizes and inconsistencies. Really, more research needs to be done to determine if probiotics are useful in reducing inflammation and increasing remission rates in Crohn's disease. So the overall goal of the study is to determine, are probiotics effective? Are they effective in reducing inflammation and thus increasing the rate of remission? So there was a study done on mice who have Crohn's disease, and this study came out in 2023. That showed VSL3 with amylase compared to VSL3 only without the amylase. It reduced inflammation, the cobblestoning, the biofilm, and the ileitis than probiotics alone. So VSL3 is a combination, is a probiotic cocktail that has 4 different types of lactobacillus. It has 3 different types of bacterophytes, and it has 1 strain of streptococcus. So the research question is, in adults 18 to 80 years of age with diagnosed mild to moderate Crohn's disease, does the use of daily probiotic cocktail VSL3 with amylase versus daily probiotic cocktail VSL3 increase the remission of Crohn's disease over a 5-year period? So design is going to be 5 years long, and this would be a clinical trial, double-blind, randomized. And so we're going to be measuring if the probiotic amylase is increasing remission rates by doing an ileoscopy twice a year, checking for cobblestoning, checking for ileitis, and then a fecal sample biannually. And we're looking for microorganisms. Is there a difference? And a certain protein that increases if there's increased inflammation in the gut. So where will this take place? So University of California Hospital, UCSF, has a department of colitis and Crohn's disease within their gastroenterology department, and they specialize in inflammatory bowel disease, IBD. They currently have clinical trials going on, and they are having more or recruiting for more clinical trials for IBD right now. So the sample size would be 344 participants, 172 in the experimental and 172 in the control. This will be a bivariable analysis, and there's 2 different groups, and the attrition rate is going to be high as 20%. The attrition rate is high in this study for Crohn's disease because of the disease burden. because of the morbidity that goes along with Crohn's disease and the mortality increase. Eligibility to be diagnosed with Crohn's disease for at least 6 months, age 18 to 80 years of age, and ability to swallow probiotics. Exclusions would be alcohol intake, smokers, drug addiction, and pregnant or lactating women. Some ethical considerations are risk versus benefits. We really don't know if probiotics work. Current research shows a B rating. B rating because it's inconsistent. We have inconsistent data, inclusive data, small sample sizes. And 5 years is a really long time to be in a clinical trial if we're uncertain if it's going to improve their health. Taking probiotics daily, we're uncertain of long-term effects. And completed ileal colonoscopy annually plus physical exams is invasive, and it's the time to go to UCSF as well. It's time consuming. So, literature review summary. One part says, no, probiotics don't work in Crohn's disease. So, the International Scientific Association for Probiotics and Prebiotics, ISSAP, their statement is that no, probiotics do not work in Crohn's disease. One clinical trial that had a probiotic strain, Saccharomyces bordeli, says it showed it did not work in Crohn's disease. Yes, other literature review summary says, yes, probiotics do work in Crohn's disease. So, in one trial, certain bacterial strains, when combined with amylase, were shown it did reduce a biofilm in Crohn's disease. The study was too short to show if it really would make an effect over a long period. 2 out of the 5 trials another study reviewed found probiotics helpful in reducing inflammation in Crohn's disease. And the last just as a side note, greater than 40% of people with Crohn's disease are excluded from clinical trials done on Crohn's disease. That's a large segment of the population of those people with Crohn's disease. They're excluded from trials that are regarding them. So in summary, research suggests probiotic strains work in harmony rather than isolation. Makes sense? Our gut microbiome has thousands of different strains of bacteria, fungus, yeast. Limited human research on probiotics in Crohn's disease has impeded conclusive findings. These are the references. Thank you for your time and listening to my research prospectus on Crohn's disease and the use of probiotics in it.